Hi, I'm Dr. Michael Hirsh, the Medical Director for the Worcester Division of Public Health in the Department of Health and Human Services for the City of Worcester, and we also represent the public health in the 6 surrounding towns that are part of our Central Mass Regional Public Health Alliance. There's so much going on about the coronavirus or COVID-19, whatever you want to call it. I just wanted to kind of take a minute to try to explain some of the things that have happened even since the last time I was able to get some video messaging out to the public. So since last we spoke, there have been emergency declarations by the president, by the governor, as well as by City Manager Augustus. And why is all this happening? Well, what we are doing is really learning on the job, watching Europe and Asia go through their version of this pandemic. And what we've been seeing is making us concerned that our country is on the same kind of trajectory as Italy. Now, Italy started out with some travelers that had come back from China and some of the countries that we had forbidden travel from, and they started an outbreak in northern Italy that has now spread all through Italy. And the issue is that it spread at such a pace that the virus has kind of overwhelmed the medical system. The medical system there had X amount of beds and X amount of ICU beds, and in those ICUs they had X amount of ventilators, the thing that help you breathe when you lose the ability to breathe on your own. And that's what we're trying to avoid here. So Dr. Fauci, who many of you have seen on TV, the brilliant virologist and infectious disease doctor from the National Institutes of Health, who has really become the point person for the federal response to this virus, has indicated that he sees this as kind of a humpback camel kind of a curve. He sees in Italy the curve that went up to the maximum amount of sick people was very, very steep and got to a point where it overwhelmed the system. So what he has been trying to advocate for, along with a lot of other very, very smart epidemiologists and public health advocates, is to blunt that height and blunt the slope of the curve. And that's why we're doing all of these things, like shutting down schools, stopping visitation in nursing homes, shutting down restaurants except for takeout, and doing the kind of things that we call social distancing, where we're recommending that people, if they can possibly self-isolate themselves or avoid contact with any groups bigger than 25 number, or do work from home on their computers. All of these things give us the possibility of making the slope of the curve less steep and the amplitude, the height of that peak, much lower. If we can spread this out in a more gradual fashion, the peak will come down. Nobody knows how fast the peak will come down, but we will get through this thing, but we will do it in such a way that we don't flood the system. And the medical environment is very, very worried about this now. We're worried that medical providers are going to get the disease and have to come offline, and then we're going to have to find replacements for them. We're worried that a lot of people who get worried at home about having this virus will come in unnecessarily, ask for testing, and the testing will really just put them at more risk for getting exposed because they're coming to the hospital. So it's a very, very difficult balancing act that all of us are trying to work through. We're not trying to be mean. We're not trying to ruin people's lives. We're not trying to take away their livelihoods. We're trying to really do the greatest good for the greatest number. So the numbers that came out of the epidemic when it hit China are concerning because they had close to 100,000 cases there. And 80% of the people that tested there as having coronavirus never knew they had it. So even if you're saying to yourself, I feel great, what's the big deal? You may be carrying that virus. And if you come into contact with someone who is in the high-risk population, that's the over 60-year-old, the person with pre-existing conditions involving lung disease, cancer, immune deficiency, autoimmune diseases, these kind of people are at higher risk for getting a significant case of this virus. But to continue on about the Chinese experience, 80% of the people had no symptoms at all. 10% had very mild symptoms. They probably wouldn't have sought medical attention if they hadn't been mandated to be tested because they were exposed to somebody that was known to have coronavirus. And then the last 10% are the ones that had significant symptoms. Half of them ended up in the ICU, and half of those died. So that's what we're trying to cut down on, is the number of bad cases that end up in the ICU, because they essentially, if you end up in the ICU, 50% of those patients are going to die. It's a small part of the overall number of people that are going to get coronavirus, but we've got to try to cut down as much as we can on exposing that vulnerable population to the disease. So all of these things that are changing your life drastically, having to have your kids home for 6 to 8 weeks, having to do work from home, not being able to go out to the pub and enjoy yourself on a Saturday night, having no sports as a distraction because everything is shut down. These are the things that are part of what I would call the shared sacrifice of 2020. And now our generation has been through some things like this. The times that we went through, the economic crashes, I think, are one thing. And you remember there was one in 1989 and there was one in 2007. We went through 9/11 together, but it was nothing like what the greatest generation went through in 1941 to 1945, where we were coming through a depression, and here comes this two-front war with Japan and the Axis powers in Europe. People were saving tin to help with the war effort. People were growing victory gardens to help with the war effort. People were saving rubber. People were recycling everything. People were really changing their entire lives to help us through this effort. We're going to have to adopt some of that courage and some of that dedication and some of that shared sacrifice to get through this. I think the Worcester City government and state government are clearly going to help every way we can. We've had a lot of really good emergency legislation passed and executive orders passed that will help people with getting low-cost loans for businesses that are kind of getting destroyed now because of the lack of customers. We're going to be finding that there's going to be more help for people getting food if they can't get to it. There are going to be delivery services that will be bringing food to the people that can't get it, and they won't be charging delivery charges. These are the kind of things that the government can help with. And I have to say that working in the city, I'm so impressed with how we've all pulled together. We're all rowing the oars at the same time together. And I don't think that there's anything we can do other than be patient, be understanding. I completely, as a pediatric surgeon, know what it's like to have a bored kid at home that has no distractions. We're working on that. The library in town, our medical school, working with the public, with the Worcester Public School System, are going to come up with some story times and some other things. This is really what I was trying to talk about yesterday when we had our press conference about social distancing. That's the name that the epidemiologists and the infectious disease specialists call the distance that they want people to keep around themselves so that they minimize the amount of spread. We know this virus spreads from droplets, so when you cough, when you sneeze, about a 6-foot radius around you can be infected, and that's why it's so important to stay out of those crowded places. And I think distancing is the right word. It's the social distancing part that I take issue with. I think we can have physical distancing, but we can't have social distancing. If we allow ourselves to become isolated and afraid and suspicious of one another, we will really, as a society, start to fray and fall apart. So we've got to reach out to each other, and we have more technology to do that now than ever before. Sure, there's the telephone. You could pick up the telephone and call your elderly neighbor and check in on them. But we have internet for a wide swath of our society. We have smartphones and other kinds of phones where we can text with each other, we can email each other, we can go on virtual chats, FaceTime, Skype, whatever it takes. We have got to stay connected. And we're going to try to organize some programs in the city to try to make sure we encourage that connection. And I would urge you to don't let yourself wallow in your isolation and just watch the television and get more and more worried about how sensational occasionally the coverage of this virus is. I would instead say this is an opportunity for you, if you haven't written the book that you always wanted to write, or read the book you always wanted to read, or just binge watch the show that you never saw from the beginning. Look at it as one of those things where it's finally allowable to just be indulgent, self-indulgent, but not self-isolating to the point where you're totally disconnected with your neighbors and your friends. Stay connected, stay positive. We are going to get through this, and with everyone pulling together, I think we'll come out of this much stronger.